Billie Eilish has finally come out to discuss her Tourette syndrome, and she did so with David Letterman. Let's look at it.
Then the awards, and what's going on? The fly?
No, I'm ticking.
I'm sorry. Did that bring that on?
The lights.
Really?
Yeah.
There's the first
If you
example.
film me for long enough, you're gonna see lots of ticks.
She said, no, that's a
Is that
tick.
okay or not okay?
I don't care.
Can I ask you anything about this?
Yeah, absolutely.
I really like how David is going about trying to step into this conversation. One, he checks to make sure that she's comfortable with him asking those questions. Likely he would have changed the environment. She said that the lights were what caused her tic to happen. And he's asking if it's okay if he asks questions. This is really how we should go about talking to people about these kind of disorders and symptoms.
Right, they think I'm going like, as like a funny move. And so they go like, and I am always left incredibly offended by that.
Yeah.
Or they go like, what?
Right.
And I'm like, and then I go, I have Tourette's, and then
Well, see, I was guilty of that because.
No, but you.
Yeah, but we're sitting here talking, everything's fine, and then and because I'm me, I think I've said something that's pissed you off.
It's interesting how David Letterman thinks that there's something going on with him, that he's done something offensive in order for his own brain to explain what happened with Billie when she did the movements that she did involuntarily. We tend to do that with mental health disorders. If we don't understand them and we're not just judging them right out the bat, then we tend to think, what did I do? Did I do something wrong? Because we're always thinking about ourselves first, not even in an egotistical way. It's just how the mind works. Let's talk about what Tourette's is in the first place. Tourette syndrome is a diagnosis where you experience multiple motor tics and at least one vocal tic. What is a tic? Tics are irregular, uncontrollable, unwanted, and repetitive movements of muscles that can occur in any part of the body. It's hard to know why tics actually occur, but we think it has something to do with the part of the brain that controls movement. Usually these tics start anywhere from between like 5 years old and 15 years old, and those numbers can change. And usually the tics can get better over time with age or with treatment. Some of like the movements, which are the motor tics, would be things like clenching your hands, moving your head, opening and closing your mouth, and things of that nature. For the repetitive sounds, like the vocal tics, it could be things like clearing your throat, sniffing, or grunting, or even saying words that you wouldn't actually want to be saying, or having an inability to say the words that you want to say. Tics can happen even outside of Tourette syndrome, but it's when you are experiencing multiple motor tics and at least one vocal tic for a certain period of time that you'd be diagnosed with Tourette syndrome. The CDC tells us that it's 0.3% of children between 6 and 17 are diagnosed with actual Tourette syndrome. So it's a pretty rare condition. Tourette syndrome is also accompanied with other mental health disorders like ADHD and OCD because of the way that the brain is functioning.
I actually really love answering questions about it because it's very, very interesting. And I am incredibly confused by it, and I don't get it.
When did this come on you?
I got diagnosed when I was 11, and I had like small ones as a kid, like, you know, or like I did that a lot when I was a kid, and then when I got older.
Yeah, again, usually the tics start to show up in childhood. So Billie's saying that she first started experiencing these motor tics when she was 11, or at least was diagnosed when she was 11. It makes complete sense. And it does sort of start off more subtly. And then we get anxiety that are attached to these tics. And then the anxiety almost becomes the fuel for them at times. And it can be really difficult to stop them. And that's when the condition can get worse. I think it's really great that Billie is talking about how it's rare, but it's also common. It's common more so than people think because there's something called masking. There's something called trying to hide whatever you want to call the issues or the problems or the symptoms that we experience because we just don't think people are going to respond well to them. And she mentioned that earlier, that she feels really offended because people respond in one of two ways. Either they laugh because they think she's trying to be funny because they don't understand it, or they look around really confused and they get really uncomfortable. Either way, that's going to make her uncomfortable also because it's a part of who she is and it's causing people to react in a way where they sort of distance themselves from her, or it creates an environment where she isn't able to just bypass that behavior that she just had and move on with her life. It becomes basically a stop sign. And we have to acknowledge this in some way, even if she doesn't want to.
Do they dissipate for a period of time?
Yeah.
Do they remit?
Yeah. They don't ever like, I never like don't tick at all because the main tics that I do constantly all day long are like, I wiggle my ear back and forth and like raise my eyebrow and click my jaw and do that and like flex these muscles. These are things you would never notice, like if you're just having a conversation with me. But for me, they're very exhausting.
Motor tics are so exhausting. It's the body constantly exerting energy energy with no actual purpose. It's not resulting in any action that's going to cause you benefit. It's not helping you actually complete a movement that's doing an action that you want to do. It's just constant, repetitive, unwanted movements that cause probably a lot of emotional distress and definitely physical exhaustion. It's the motor part of your brain always on and or on during times that it doesn't need to be.
It's not like I like it, but I feel like it's like my
You have to make friends with it.
Yeah.
You have to make friends with
I
it.
have,
Yeah.
yes, I have made friends
Yes,
with it.
you
And
do.
So now
Wow.
I'm pretty like confident in it.
When you're performing, does that happen?
No.
Becoming friends with your mental health symptoms, becoming friends with parts of you that maybe at one point you wished would go away, but sort of assimilating and accumulating them within you is a really great strategy for just accepting who you are. And oftentimes when we can actually accept the truth about who we are, then we get to a place where we can actually do something about it if we want to do something about it at some point in our life.
When I'm moving around, I'm not even ticking at all. You know, when I'm riding my horse, I'm not ticking. When I'm like moving and like thinking and focusing, when I'm singing, when I'm
What about go-karts?
riding.
What?
No ticking in go-kart land.
It makes complete sense that when she's active and she's moving and she's writing and singing and performing, that she doesn't experience tics. This happens because then we have conscious control over our nervous system in an excessive way, and our entire environment is changed and we're dead on focused on what's going on. So it makes sense that that's happening to her. And I really like that she has that output that she needs. Talking about mental health conditions in the format that Billie and David just did was absolutely excellent. Please keep in mind that, as always, I am glad that you exist.